She was vivacious, radiant, red-haired, charming, completely outgoing, lovable, sweet, tender.
My daughter before PANDAS, I think, was a typical 5-year-old girl. She was rambunctious. She had always kind of been talkative and outgoing, had a really outgoing personality, lots of friends, lots of invitations to play dates, lots of invitations to birthday parties. I would say she borderlined on a high level of activity. I mean, she was a child who, when she was there, you knew for certain that she was there. So a really active, kind of rambunctious kid, but I think very typical of sort of outgoing 5-year-old.
She was happy, vivacious 7-year-old, played in the yard, cousins every Thursday, we'd have dinner.
Before, Megan was very hyper aware of everything around her, very intelligent, very social child, very funny. As soon as she could talk, she was funny. Just very, when I look back at pictures, she was just a laid back but really wanting to be in this world kind of kid. She always had a lot of friends. She just loved life. And then in 4th grade, when PANDAS hit, her world just completely shut down.
In February, she contracted her first strep infection ever documented that we had. She went on to contract strep again in March, and she contracted strep on a 3rd time by April. And we didn't notice anything right away in April, but I would say in May, sometime mid-May, was the first time where we were putting her to bed and she required that I move everything away from the edges of her bureaus to the inside so they wouldn't fall in the middle of the night and make a loud noise. The next night, it was not only that I had to move everything away from the edges of the table, of all of her bureaus, but I had to do the ritual, even adding on extra kind of words. And it was an overnight strange behavior. The 3rd night, I noticed that she was counting things beside her bed.
She'd had a strep infection and lots of ear infections, and out of nowhere one day, she started to get convinced that the people at the pre-K were switching out her lactose-free milk for regular milk, and that she was convinced that they were trying to give her bad milk.
She got a lot of sinus infections, one after the other, kept going back to the doctor, and she, in April of 4th grade, I got a call from the guidance counselor saying that she couldn't go back to the classroom. And I was like, what do you mean she can't go back to the classroom? She'd had a lot of anxiety leading up to this, but she was like, we can't get her back. You have to come get her. When I got her, she was a completely different kid. She was just, had her head down. Her teacher kept saying, come on, Meg, you're a great kid. You're one of my best students. Just come back. And she couldn't do it. And she was just terrified and looking at me like she just needed to get out of that building.
She was afraid to go outside. She was afraid of a tornado. That was her biggest fear. With sensory issues, we couldn't, socks were a problem, pants were a problem, staying in school was a problem every day, severe separation anxiety from us.
It wasn't like she woke up and she was a completely different kid. She was still kind of going to school, but still had anxiety, trouble sleeping out, you know, wanting to sleep in our bed. Sudden onset doesn't necessarily mean overnight. It can happen within weeks.
When I finally got the blood work done that he prescribed in May, because I didn't believe she had PANDAS, was she went virtually insane. And it was slow over the course of weeks. She was not able to dress herself in the morning. She couldn't wear the clothes. She stopped getting on the bus in the morning. Screaming and arguing. She would not leave our side. She stopped going to birthday parties. She stopped getting invited. She couldn't play soccer. She couldn't ride her bike. She virtually was building a wall around herself that summer. Her rages became weekly, they went to daily, and then they went to all day long.
Full of rage and fears and obsession with death and dying and separation anxieties.
She was hallucinating, seeing things that just like looking behind me and screaming. Every day was just a battle.
We felt like we just lost her completely.
I called the pediatrician almost immediately. And he said to me, and I remember this like it was yesterday, he said, I read something about a disease called PANDAS, and with her strep infection that she's just come off of, I think you should look into it. My first call, I'm like the only one I think in the room today.
You know, we had tons of diagnoses. She has anxiety, she has OCD, she has mood disorder, she has rapid cycling of moods, you know, depression. It was just on and on and on. Let's try this SSRI, let's try this one, let's try this. You know, finally I'm saying, how can it be that none of these meds touch my kid? This doesn't make sense to me. There's something else. We're missing something here. And we were.
Until he had us in the room with her out of the room and suggested that maybe my daughter had been sexually violated.
I went through 3 pediatricians, 2 neurologists. I had a urologist at the time for her, for urinary problems, and we went through 5 psychiatrists before we even got a correct diagnosis.
Many people have a sense, even though they might not talk about it out loud, that somehow there was some kind of guiding hand that led them to find out about PANDAS.
I took her to the emergency room because she said she just wanted to die. She was climbing out her bedroom window. She was trying to get out of the car where I was driving. And they mentioned PANDAS, but which was unusual in 2006 at the time. But they didn't send any blood work out. So what happened is, because they mentioned that, I poured over Susan Sweeto's case studies at the time. That was the only thing about PANDAS that was online. And I kept reading and thinking this was my daughter.
Being told that, you know, you have anxiety, you have a mood disorder, you have depression, you have a panic disorder, you have sleep apnea, no, you have sleep insomnia, no, you don't have a sleep disorder at all, we're just not sure.
I went on the web after not being able to find any help from the pediatrician, went on the web, and, you know, there it was. And it's just that moment I think every parent has when they read the first description of PANDAS. Is like, OMG, that's my child.
After going 11 years undiagnosed, I wouldn't wish that on my worst enemy. The main thing I would say is trust your gut. My mom's gut says PANDAS, and she was right.
Doctors in Boston tried to help her, but it wasn't. We saw improvements, but it wasn't enough, and I had to go to Dr. Trifoletti in New Jersey, who's been my hero. But Dr. Trifoletti looked at her and realized how terrified she was. He looked at her pupils. He realized that she's in this frightened state. He talked to her. None of the doctors, they tried to talk to her, but he was able to talk to her because he's so kind. He told us he got it, and she would get better. And he said, I understand your pain. I literally left his office and got in my car and sobbed because a doctor finally got my kid.
Her pediatrician called and said, let's put her on antibiotics. I don't really know what else to do. So we put her on antibiotics. Within 5 days, she stopped raging. Within 10, she was able to get dressed in the morning. And it actually concurred with her second appointment at Children's Hospital. And I brought her back in to see Dr. Molly Benson. This is only 2 weeks after she saw her. And she said, this child that you brought in today is not the child you brought in 2 weeks ago. And there isn't an antibiotic on the planet that will treat a mental illness. And from that day forward, it was, I think, September 15th, we didn't look back. And we focused exclusively on treatment for PANDAS. When we're talking getting better at this point, it was 30% better, right? Was she normal? No. But was she psychotic? No. Was she going to kill us? No. That was an improvement. But it was a minimal improvement. And it wasn't until we went on and did some other things.
She was still kind of going to school, but still had anxiety, trouble sleeping out, you know, wanting to sleep in our bed. You know, at the age of 17, what 17-year-old kid wants to sleep with their mom in bed? She gets IVIG, she comes home, says goodnight, and walks into her room. My husband and I looked at each other like, what just happened? Every night it was a struggle to get her in her room. You know, IVIG changed her life.
I'm 2 weeks post IVIG, my 6th treatment, and I am a full-time college student with a boyfriend who works, and I mean, IVIG is liquid gold. Anyone who is hesitant my advice would be to go for it.
So we flew to Chicago and we embarked on our first and only, actually, IVIG treatment. Week by week post IVIG, things came back. And what was really poignant to me was at about 3 months' time, she came home from school, which coming home from school with a smile on her face was a rarity at this point, you know, but so she had started to come home with a smile on her face. And she came home and she said, "Mom, you're not gonna believe what happened today." And I'm listening to her give me this story and I started crying. I mean, tears streaming down my face. And she's going, "Mom, why are you crying? It's a funny story." And I was crying because I had realized that she was in first grade and I had not heard her tell me a funny little story from school in more than a year at that point. And when I heard that, I knew she was on her way back.
I mean, finally, there was hope, you know, to hear your child will get better. There's treatments. You know, hope is a very strong thing.
I'm hoping that if we can obtain an IVIG, whether our insurance covers it or not, at this point in my life, I don't care. We'll find a way to do it.
At the beginning, it's been lonely, and I'm hoping for the parents that are starting this journey now, they won't have to go down that lonely road, that they are going to have a quicker diagnosis.
More is to come, and our children are going to get better.